been in this county for the last 10 years. My daily routine involves attending to children in the wards, as well as also running follow-up clinics. I've encountered so many issues of medical importance in children in Homa Bay, but the striking one I see is sickle cell. The previous information I used to get was that you could get maybe a sickler once in a while. But since we started engaging the hospital partners and the community on targeted testing, we have come to realize that sickle cell burden in Homa Bay is quite huge. And of late, we are diagnosing in the wards, and in the clinics, we are diagnosing close between 7 to 10 patients per week.
We have seen number of sickle cell cases rising steadily. And one of the reasons why this is happening is that we are not offering genetical counseling to our young adults who are actually getting into marriage. Remember, we have our young adults who are sickle cell trait or something we call carrier. And they get into marriage not knowing their sickle cell status. When this happens, that the young adult who gets married with another person who is also a carrier, then they have a probability or rather possibility of getting a child who has sickle cell disease. And this is happening so rampantly because one of the reasons is that those who are trait or those who are carrier, they don't show sickle cell symptoms. They live a normal life. And so unless one takes an initiative to know their sickle cell status, then they will not know that they are carriers until they get a child who has sickle cell disease.
We know that 60 to 70% of Kenyan population seek care from public health facilities, which we know have skilled healthcare providers, have good infrastructure, but they don't have what to give to the patients.
This is one of the chronic conditions that is not catered for in terms of support by maybe the national government, the county government. We are getting little support from the partners, but you look at the scale of what support is required for these patients is momentous, is enormous. From diagnosis to routine care to addressing the complications that arise from time to time, it is a huge, huge undertaking.
And the project is basically about sickle cell and sensitization and teaching, and also just making sure that we are creating awareness about sickle cell. I am the founder of Sickle Cell Uhuru Trust, or Scut Kenya, and also I sit in the board of directors for the mother umbrella of sickle cell called Sickle Cell Federation of Kenya. I am a voice fellow with NCDI Poverty Network, which meaning that actually they're supporting me to do this project. And this is one of my projects that I'm doing under the fellowship. And the fellowship is 18 months, and I've been learning a lot through them. And just making sure that our voices are heard, especially for people who are living with non-communicable diseases. Our voices are heard, and also it helps us think, how do we tell our stories of us and now? How do we tell the metrics of everything that we've been taught through the fellowship? And also just making sure that we can be able to carry out projects like this of creating awareness and empowering other people who are living with sickle cell or other non-communicable diseases like me.
One of the things that we have noticed is that a number of patients get referred to the county hospital for care, and some of these conditions that make the patients get referred are things that can be managed at the lower level facility. And so training healthcare providers on how to manage such conditions at the lower level facility is of importance, just to see that the burden of influx of patients living with sickle cell disease at the county hospital is reduced.
So basically we had different people, different healthcare providers, from the medics to the clinical officers, to the nurses who usually handle the patients, to the psychologists, to the pharmacists, to the nutritionists. And these are people who always interact with these patients every single day.
Before the advent of the national guidelines, every facility or every county was using its own way of handling this disease. But from last year, we had a standard way of managing this condition, and with that came the national guidelines for management of sickle cell disease. This is actually a great step forward because it will standardize care from region to region. We shall be reading from the same script. However, what I was emphasizing yesterday was to enlighten the healthcare workers who are available about what conditions, acute conditions that are likely to lead to death, as well as lead to disability in future if not handled well. So my main aim at that moment was to bring out the acute and emergency conditions that can arise with this disease. You may have a child who is just quite stable, but within a short while he comes back, is actually having an acute complication that can lead to death.
So we get gaps in the management of sickle cell disease, knowledge gaps. Just the fact that it's a genetic disorder, inheritance is autosomal recessive, test know your sickle cell status, make informed choices is the message we are going out with.
It was a good move and a big contribution to us in terms of knowledge and in terms of on how we are able to handle our warriors in a way that is able to let us move with them as one family and one community. One of the takeaways that I got from the training, starting from the relationship, how we should relate with our clients.
Management of complication of sickle cell, because we find most of our patients come with several episodes of crisis when they come to the hospital. So we need to be at par with the quality management of the crisis and also to educate them how they can prevent having frequent episodes of crisis.
Test so that you know if there's any family history, if you have any other children that have sickle cell anemia, then it becomes very important to do neonatal screening versus waiting for the patient, for the warrior to be sick.
Tuo na kuma na tuo chaka, mano yud ka nigi tuo mar sickle cell. No yud ka nigi tuo mar sickle cell ka ja higa ang'wen. Remba no rumo. Obe omedare. Koro bachak gik chien ka. Tienda gi nobiro mokuot. Kane gisekuot kabisa, to giketo gitudo matin kama kendo kama. Koro pudo gino. Mano wabiro osiptal. Wabodo osiptal district. Kadi puda kamano. Koro kawa niwa discharge wadok ot. Kana kazi maber matin. To kano adhi ot koro abiro wang'i kama kapo ka gik moko marochere kama owuok. Ka gigo nosewuok, to koro wang'e nang'e ni dhi chango. Apo ka koro ochako medore ma koro obedo adhola, mane ok apar ni nyalo bedo e tienda. Kagone Nyasaye malich erokamano kuom gima osetimo. Ne ok ang'eyo ni anyalo chung' machak awuothi kaka tienda ne chalo.
Ka chieng' moro adhi osiptal moro, kasto nabedo admitted, nan gi rem, kasto sister moro obiro to penja ni tang'o miywago, takone ni an gi rem e denda te, to kona ni kakiduong' ni ywak, tapenje ni be ing'e rem makadhi adieri, ma nachung' ma apudho braniola manotwena, madhi ir daktari mana admita, makone ni miya referral, kokamano miya discharge mondo awuog e osiptandni. Ma nagitamore, ma awacho ni kae to ok thiedha, umiya discharge kata umiya referral. Mana gimiya referral madhi.
Tuo nyathina Rick chakore ka en 2 years. Koro notuo dala, kae to akele osiptal, ne en weak kabisa, to ne ok wang'e gimoro amora. Koro kwakele osiptal, dakteche opime. Kosepime, to kona ni mama idhi e ward. To kana winja nadhi e ward, mano kuma na ywak. Ka para ward, nakele district ka. Koro ayuaka nyaka daktari moro biro ni beda jachir, nyathi biro dhi maber. To en week moselokore ratong' ma to dende te ogine, olokore yelo kama, to kuot. Koro wach mar kuot ni to ne onge gimoro amora mane wang'eyo. Koro kwakele to gipime to giyudo ni en gi tuo mar sickle cell.
Chieng' no nadhi adhia skul maber, to kanochopo gimoro saa 9 odhiambo, to achako winjo ka an gi rem. Koro en be ne ok ong'eyo ni ka an gi rem aina no to otima nang'o. To bedo ni ne en odiochieng' mokwongo, en be nokia ni mano rem mane. Ogocho ne janyuolna, to janyuol onyise ni nyathina no terna osiptal, waromo kanye, waromo kode osiptal. Koro kane mama obiro, to en be ne en gi buok. Naneno mana ka aywak to mama be ywak. Ne ok understand gimomiyo en notimo ang'o, noywak. Koro nokao a long duration kapok opimona ni en wach mane, nikech koro bang' chieng' no koro ne en gima ne en orika, en koro time no ema na insist ne manyise ni ochopo kuma koro winjo bed ni amba timo ang'o, ang'eyo ni en wach mane. Koro nochoka chir monyisa, to bedo ni ne ok understand maber gima sickle cell en, ambe nawacha ni kopo ywak na gi bedo na gi rem aila ni ema nyalo miyo janyuol na be ywak kama. Koro chopo kuma ambe ka an gi rem tabo timo nang'o, abo bedo jachir mondo kik mama be timo ang'o, bed piny. Koro jani no noendelea mana kamano, to kuom hawi marach nyathiwa maluwo bang'a bende nochako bedo matuo. Koro kane wafwenyo ni wan gi the same condition, to ne wajiwore ka tuo to nyabiro lima, mogo koda mbaka, anyanyise ni bada ni lit, to enema bedo nong'eyo ni rem no en rem machalo nade. Onyisi ni we arudhni go matin. Koro apani bedo ni ne wan ji ariyo manyalo understand ourselves, nikech jomamoko nok understand, to en onyalo understand rem makale, to onyisi ni warudhni kama, karudhoni kama dongi winjo maber.
We know that there are parents that probably still do not have all the information about sickle cell disease, on how to care about their children who get diagnosed with sickle cell disease. So it was important that we get to meet them, just to teach them about common things that they need to know as parents about sickle cell disease, on how to identify danger signs that probably their children could be presenting with, and on how to reach the hospital or to reach the doctor or clinician in time before the child, it gets late to manage the child.
So that also we empower them, so that they can also be their voices of themselves, they can speak out, they can also start support groups and also empower other, because whatever we are teaching here is something that you can carry and also go teach other people in your community. So it's not only, we are not only teaching or passing information or training you to keep everything that you've learned here in your office. No, go out there, get a group of 5-10 healthcare workers, teach them, get a group of parents, teach them, get a group of any community leader, teach them, and that way then we'll spread the news of sickle cell.
The fictions that go around is that these patients, first of all, they are malnourished, so they look small. Number two, they get blood transfusions every now and then. Number three, they are admitted very frequently. So what the society doesn't know is, why do they have such?
One of the things that need to go out there and go out there clearly is that sickle cell is never a condition from one parent. We've seen marriages breaking because the husband thinks the condition has been inherited from the mother's side, or rather from the wife's side. Or the wife thinks this condition probably comes from the husband's side. It's important to note and to understand, and this should go to our community, that for a child to have sickle cell disease, both the parents must contribute. And so it's never a blame game on, where does this fall? Is it the mother or the father?
Sickle cell disease is a killer. Sickle cell disease causes suffering. Sickle cell disease impoverishes. It makes families poor. It requires resources to manage. Families and societies on their own cannot manage. We need to partner up. We need to team up. Different stakeholders, those who can provide financial resources, those who can provide other resources like diagnostic services, those who can provide drugs, those who can assist in blood services, blood transfusion services, policymakers. We need to come together and join hands so that we can put this as a priority. In Homa Bay, it's an underlying cause of death as well as morbidity for many children.
If we could get an NHIF package, essential package from NHIF, it can really help. These patients have a chronic illness, they live with it all their lives. So we would like the public health facilities to be equipped well enough to take care of them.
And as parents, we must now take responsibility the moment a child has been diagnosed with sickle cell disease. And this is the time you need to stay together, because you will need psychological support from one another. You will need financial support from one another. You will need economic support from one another. And so this is even the spiritual support. This is the time you need to pray for one another. And so if we don't stick together at this point and start crumbling, then we find that the parent who remains with the child get so much stress. A number of times it's the mothers who get affected, yet to get the reason why. But our men usually feel that when a child has been diagnosed with sickle cell disease, then probably this is a condition that has been brought about by the mother, which is not right.
Such a meeting is very crucial because it acts as a forum to enlighten them and show them that this condition, this is what you are likely to get. This is what we are likely to complicate to, and this is what you need to do to avoid some of these complications. At the same time, it's a part of sensitization. They're a part of the community. Remember, when stigma strikes, many of these, especially children, even are prohibited by their parents from going out and socializing with other children. They face discrimination in their families. They face discrimination in the schools. They face discrimination at their workplace. And this can only be destigmatized if we bring up the issues and show them this is exactly the truth.
If we diagnose children with sickle cell disease before they develop complications, then you find that the management that we put in place tend to work better than starting these children when they on drugs when they already have complications. For the young guys who come from malaria endemic zones, the young guys who come from coastal region, the guys who come from western region, and the guys who come from Nyanza region, it's important, please, before you get into marriage, get to know your sickle cell phenotype, get to know your partner sickle cell status, so that you don't blame yourself or show sympathy to yourself probably in future when something happens that you get a child who has sickle cell disease.
When you get better healthcare, then you are able also to sort other issues at home, in the office. And a person living with sickle cell does not mean that I can be limited. If I want to be a filmmaker, I'll be the best filmmaker ever. So don't limit your children, let them explore, take them to school. If they want to be professors, educate them, because they are the hope of tomorrow.